If you are over 40 and have started noticing changes in your erections, the problem may not actually be about what's happening in the bedroom. It could be a sign that something is happening inside your blood vessels. I know this isn't a topic most men feel comfortable talking about, but stay with me for a moment because what I'm about to explain could genuinely help protect your health. Today you can walk into a pharmacy and buy Viagra without even seeing a doctor. Within a few minutes you can leave with the pills in your hand. For many people that convenience removes a lot of embarrassment. But there's something concerning about that. What if the reason you need Viagra isn't just a temporary issue? What if it's actually a sign that your cardiovascular system is beginning to struggle? By simply treating the symptom and skipping a medical checkup, the underlying problem might continue silently for years. Viagra works by improving blood flow to the penis. In simple terms, it helps the blood vessels there relax, so more blood can enter. But the blood vessels in the penis are not separate from the rest of the body. They are part of the same vascular network that also supplies the heart, brain, and kidneys. If those small vessels aren't functioning properly, it may indicate that other blood vessels in the body are also starting to develop problems. That's why medication can help with the erection itself, but it doesn't fix the bigger issue happening in the rest of the circulatory system. Years later, someone might suffer a heart attack or stroke, and when doctors look back, the earliest warning sign was actually erectile dysfunction caused by tiny blood vessels failing long before symptoms appeared elsewhere. Erectile dysfunction is extremely common. Around half of men over the age of 50 experience it, and the likelihood increases as men get older. Many men simply accept it as a normal part of aging. They might feel embarrassed, get a prescription for Viagra, and move on. However, what many people don't realize is that erectile dysfunction can sometimes be the earliest visible sign of cardiovascular disease. It may appear years before symptoms like chest pain, heart attack, or stroke begin to show. When men think about erectile dysfunction, they often assume the cause is stress, low testosterone, aging, or psychological factors. Those things can certainly play a role. But for men over 40, the most common underlying cause is actually related to blood flow and artery health. In many cases, erectile dysfunction is primarily a vascular problem before it is a hormonal or psychological one. To understand this better, it helps to look at how an erection actually happens. An erection is essentially a vascular event. When a man becomes aroused, the nervous system releases a chemical called nitric oxide. This molecule signals blood vessels to relax and widen, allowing more blood to flow into the penile arteries and fill the spongy tissue inside the penis. At the same time, the veins that normally drain blood away become compressed. This traps the blood inside the tissue and maintains the erection. For this entire process to work properly, the blood vessels must be healthy, flexible, and able to produce enough nitric oxide. But if the arteries start to stiffen, or if the inner lining of the blood vessels becomes damaged due to factors like high blood pressure, smoking, or high blood sugar, then blood flow can be reduced. Fatty plaques may begin forming inside the artery walls in a process known as atherosclerosis. When this happens, erections may become weaker, harder to maintain, or less reliable. One important reason this matters is the size of the arteries involved. The arteries in the penis are very small, typically about 1 to 2 millimeters wide. In comparison, the coronary arteries that supply the heart are about 3 to 4 millimeters wide. Because these penile arteries are smaller, even a small blockage can significantly affect blood flow there first. For example, a tiny plaque inside a 1 millimeter artery could already block half of the blood flow. The same plaque inside a larger heart artery might not cause noticeable symptoms yet. This means erectile dysfunction can appear years before symptoms of heart disease become obvious. In many cases, it can show up 3 to 5 years before conditions like angina, heart attack, or stroke develop. Your body may actually be giving you an early warning sign. In fact, it can be one of the earliest signals that something is wrong. While this warning appears in the tiny blood vessels of the penis, the larger arteries that supply the heart, brain, and other vital organs may continue to deteriorate quietly in the background. Often, no one pays attention to this early signal, and the disease keeps progressing unnoticed. Sometimes that warning gets ignored or simply masked by taking a pill from the pharmacy, such as Viagra, but this is the moment where people should start paying closer attention. By the time the coronary arteries or the carotid arteries begin to produce noticeable symptoms, the disease is no longer in its early stage. At that point, the focus often shifts from prevention to managing serious damage and trying to protect survival. Research strongly supports this connection. Erectile dysfunction is closely linked with many well-known cardiovascular risk factors, including high blood pressure, insulin resistance, type 2 diabetes, high LDL cholesterol, smoking, and obesity. Studies consistently show that men with erectile dysfunction face a higher risk of major cardiovascular events such as heart attacks and strokes. They also have a higher overall risk of death compared to men who do not experience erectile dysfunction, even after accounting for other risk factors. In emergency medicine, doctors often see the late stages of cardiovascular disease, but what matters even more is helping people recognize the problem years earlier. The unfortunate truth is that many heart attacks could have been prevented. In many cases, the body gave warning signs years in advance, but those signals were overlooked. Instead of focusing on prevention and identifying the disease early, many people end up simply treating one symptom. A pill may temporarily help with erectile function, but it does not address the underlying cause. It does not repair damaged arteries or reverse the buildup of plaque inside them. It simply manages one effect of the disease while the root problem continues to progress quietly. So what should you actually do with this information? If you are a man over the age of 40 and you notice new erectile difficulties or even a gradual decline, it is important not to ignore it. And it is also important not to rely only on medication without understanding what may be happening inside your body. Medications like Viagra work by increasing nitric oxide levels, which improves blood flow. But again, this only treats the symptom rather than the cause. Instead, treat this as an opportunity for a health check. Visit your doctor and begin with some simple but important tests. One of the first things to check is your blood pressure, because hypertension often develops silently and can damage the lining of your blood vessels over time without obvious symptoms. Another important test is the HbA1c blood test, which measures your average blood sugar levels over the past 3 months. Many people are surprised to learn they are actually pre-diabetic or already living with type 2 diabetes, since these conditions are extremely common. You should also check your lipid profile, which includes LDL cholesterol, HDL cholesterol, and triglycerides. These values help reveal whether cholesterol is contributing to plaque buildup in the arteries. Measuring your waist circumference can also provide valuable information. Excess fat around the abdomen, known as visceral fat, is strongly linked to insulin resistance and increased cardiovascular risk. Lifestyle factors are equally important. Smoking, lack of physical activity, poor diet, chronic stress, and poor sleep can all negatively affect the health of your heart and blood vessels. Having an honest conversation with your doctor about these factors can help you understand your overall cardiovascular risk. The encouraging part of this discussion is that the same actions that improve erectile function also improve cardiovascular health. The solutions are not separate, they overlap almost completely. Regular physical activity, especially a combination of resistance training and aerobic exercise, can improve nitric oxide production, support healthy blood vessels, and reduce blood pressure. Losing excess weight, particularly visceral fat around the abdomen, can significantly improve insulin sensitivity and overall vascular health. Diet also plays a major role. A Mediterranean-style diet rich in vegetables, legumes, nuts, seeds, olive oil, and oily fish has strong scientific evidence supporting its benefits for heart health. Interestingly, studies also suggest that this type of diet can improve erectile function independently. In many ways, erectile function can act as a barometer for vascular health. If it improves, it may indicate that your blood vessels are becoming healthier. If it declines, it could be a signal that something needs attention. The hopeful part of this biology is that this condition can often be caught early, when lifestyle changes can still make a powerful difference. Unlike many chronic diseases where damage has already progressed, this situation often presents a chance to intervene early and potentially reverse the problem. So if you notice changes in your sexual health, do not feel embarrassed. And rather than immediately turning to medication alone, consider speaking with your doctor first. Checking your cardiovascular health and making meaningful lifestyle improvements could have a much greater impact on your long-term well-being. Sometimes the body gives us small warning signs. The men who respond early are often the ones who prevent the heart attack that never happens. No emergency, no ambulance, just another normal day because they paid attention to a signal that many people ignore. And sometimes, the smallest signal can be the one that ultimately saves your life.